Okay. Meantime, the surge in the Delta variant leaving many parents worried about vaccinating their children and the spread of the virus in schools. Joining us right now is Dr. Scott Gottlieb, former FDA commissioner and CNBC contributor. He also serves on the boards of Pfizer and Illumina. His new book, Uncontrolled Spread, Why COVID-19 Crushes Us and How We Can Defeat the Next Pandemic, is out in September. Doctor, it's great to see you as always. But the numbers over the weekend continue to concern lots of parents and lots of individuals around the country. And I'm thinking specifically about states in which there are now laws effectively that prevent mask mandates and what you think should be done in those states.
Well, look, I think we should be leaving discretion to local officials to implement measures based on local spread. Different parts of the country, certainly different states and regions, but even different localities within a state are experiencing this pandemic in very different ways. And I think to tie the hands of local officials in terms of implementing measures to respond to local outbreaks is the wrong step right now, especially as we contemplate reopening schools. I mean, the goal has to be to get schools open and keep them open. And we can't expect to change all the behaviors in terms of what we're doing with respect to mitigation in the schools and get the same result, especially with this new Delta variant, which is more contagious and is inevitably going to be harder to control in the schools. We are taking sort of an alpha mindset into a Delta world, and it's not going to work. We're going to see that this Delta variant is more difficult to control. We may need to start the year with the schools with some form of mitigation in place. And a lot of districts right now are withdrawing those measures, withdrawing masks, testing, distancing, potting, all the things that we did to try to control spread in schools. We can't expect to get the same result in terms of being able to control the infection.
Right. Scott, you've long explained to our viewers that in most cases, depending on what kind of mask you're wearing, that my mask protects you and your mask protects me, perhaps maybe unless I'm wearing an N95. If you get into a situation where you have half a classroom, for example, not wearing masks and half a classroom wearing masks, how protected are the kids wearing masks?
Depends on the quality of the mask they're wearing, and it's harder for a child to wear a higher quality mask. There are certain masks that are more comfortable and still afford a higher degree of protection than a procedure mask. I'm talking about a KN95 mask, which slips behind the ears and could be comfortable if it's fitted properly, or a KF94 mask, which is going to afford the user more protection. But you're right. The idea behind wearing a mask is that it cuts down on the likelihood that someone's going to transmit respiratory droplets. And so if everyone has a mask on and some people are infected but don't know it because they have an asymptomatic or mild infection, if they have a mask on, they're less likely to transmit the infection. A cloth mask or a procedure mask is going to afford the wearer some protection from the virus, but not a lot. About 20% for a high-quality cloth mask, maybe as high as 40% for a high-quality level 3 procedure mask, but most people don't wear those masks well, don't fit them well, so they're not getting that measure of protection. Obviously, with a KN95 mask, you're getting 95% protection from transmission. And now that we know more of the virus is being spread through aerosols and not droplets, wearing a higher-quality mask becomes more important.
Scott, we were talking to Steve Leisman, who's expecting to head out to Jackson Hole for a big conference in a couple of weeks from now. And there's a number of big events, conferences and the like, that are coming up this fall, some of which are now thinking about whether they need to change course and go virtual, if you will. The auto show in New York obviously canceling its show already. What's your perspective on that?
Well, look, we had talked about this many times, that we were going to have a final wave of infection that swept across the country. We thought it'd be with B117. We thought it'd be in this fall when people got back to work, back to school. And we thought it'd be against the backdrop of a population that was more vaccinated. It's coming earlier with a more contagious variant against the backdrop of a population that doesn't have as much vaccine. I think this is going to be a difficult period right now. We're going to see a wave of infection sweep across the entire country. The South is showing an indication that they're starting to peak. I think that may be more self-evident this week. But now you're seeing a pickup in cases in states like Illinois, Indiana, North Carolina. This is going to spread north, and it's going to collide with back to school. I think people who have events planned for the fall need to think carefully about how they can implement additional steps to try to protect those venues. You can require vaccination. You can do some testing. There are ways you could protect the congregate setting, even in a setting of spread. But you're going to have to probably take some additional measures than you might have had to take if we didn't have this wave of infection.
But just to put a fine point on it, is that a situation where you're going to have to, whether you're vaccinated or not, everybody ends up masking up? Or do you believe that you could have 500, 1,000, thousands of people together collectively if they all had a vaccine passport, if you will? Is that enough, given what we now know?
Yeah, look, I think that there are ways to create a setting where you can protect the venue, you can bring people together and protect the venue. You look at what the cruise ships are doing, Norwegian, which I've been working with, they're requiring everyone to be vaccinated. They're testing everyone before they come into that setting, so everyone gets tested. People do get some follow-up testing as well. So you can create some semblance of a bubble around a venue. It depends on what you're prepared to do. If you're unable to do that or aren't prepared to do that, then you need to implement additional measures. I think it's possible to bring people together in a vaccinated setting. What we've seen with respect to vaccinated people is they're not becoming super spreaders. Most of the spread that we see from vaccinated individuals is to close contacts. That comes from the real-world evidence out of Israel. And most of the people who are vaccinated who are becoming infected, we think are becoming infected from unvaccinated people. So you're unlikely, if you have a fully vaccinated venue, to have a situation where a single individual can introduce the infection and spread it to a lot of people. What appears to be the case is that vaccinated individuals are transiently contagious, so they become infected. They're contagious for a brief window because they fight the infection more quickly. And when they do spread the infection, it's typically to close contacts, people within the household.